me, as long as I'm treated with dignity and respect, and that anyone who comes to look after me will ask how I like to be addressed and not just assume that they can use my nickname or family name. Respect who I am as an individual, and then likewise to treat me as a whole person, and not just a bit of me. That I might have a problem, say, with my arm, but I've also got great problems with my knees. So it's treating me as a whole and not just a bit.
Nursing is such a privileged profession. We're looking at patients, that they're treating patients when they're at their most vulnerable. So we want to make sure that future nurses are the best they can be, and it's our role to help guide them and teach them through that process.
Well, the definition of mentorship I looked up, and it's an experienced and trusted advisor, but from my experience it's a lot more than that. It's someone who's passionate about teaching you, it's someone who's an inspiration with their practice, and it's also a role model that you can look up to. And I kind of like to think of it as having a work mum. I know it sounds funny, but in the same way as a child, a parent would nurture their child to be able to go out and experience the world and not be scared of trying new things and giving things a go. I really think that mentors act in the same way to make you feel confident and safe enough that you can't ask a silly question, or you can give things a go. I just think mentorship is a lot more than what is defined in a dictionary.
I feel that as a mentor it's very important to be a role model for our student nurses. We help them make sense of practice, and that is done through theory, reflection and constructive criticism. This then enables them to gain skills and confidence within the nursing profession, and hopefully enable them to move on within the nursing profession and give their patients a high standard of care.
At the moment, one of my mentors, Nicola, she's lovely, and she does this scheme where basically she will show me what to do first, and then she will stand by me, watch me do it, but not so close where I'm going to obviously be nervous. She'll take a step back but listen to know that I'm doing it properly and come over and check my work. And so far she's made me be like, oh, you're going to go on a spoke here, and really encouraged me to go and do things that she knows I can do while I'm on that placement. And she's also lovely as well, so that kind of makes, because I don't feel nervous to go to be with her, I feel comfortable to talk to her about anything, and that's really what I enjoy about it.
This is Jade, my student, and she's been my student for 2 consecutive years, 2 placements. We both love midwifery.
Yeah, we do.
And as a student, I feel inspired by Jade. I love having her as a student, as every other student, and it just gives me a buzz because she comes back from university with all sorts of ideas and knowledge that I might not have read, and it's just it gives me a feeling of fullness to take forward my midwifery practice through her. So
we learn together, don't we?
We learn
so I bring something and you bring something, and you've got years and years of experience, which is lovely, and you support me 100%. And it's nice to come into placement and know that we've got a good relationship, and we've learned together and we have that passion together. So from a student's perspective, I think it's really good to be able to feel comfortable with your mentor and to have that relationship, to be able to achieve your best and to be supported at all times. I said I've always felt like that with you.
The key thing for me when I first became a mentor was looking back and reflecting on my experiences as a student nurse, and what stood out to me was there were particular role models that helped me develop within my nurse training to become a better staff nurse.
One mentor, my new mentor now, she's actually gone back and she's knitted me an uterus as a teaching aid. But that just shows she's gone home and she's done that in her own time for me to learn, and I just think that's absolutely amazing. And it just shows that she's passionate about student learning. So that's one example. There's so many. My other mentor, she used to send me in the morning at 6:30 she used to send me a message on Facebook with all the information I may need about something I may see that day, so I could read it before I went in, so I'd have a bit of a background knowledge so I'm not just pushed into it.
A good learning environment is an environment that knows student is coming, that welcomes students and wants students to come and to learn. It's an environment where we have facilities and opportunities, student packs, where students can feel that they can come and approach us and feel welcome and feel part of the team.
The importance of being a mentor as well is, again, that knowledge base being transferred across to the new generation of nurses that are coming through. And things change as well, so it's good for them from their first years, going right through to their third years, how things have progressed in that short period of time. As we know, the NHS is currently evolving, always evolving.
My mentor encouraged us to go to as many different study days as possible. So I was within local primary mental health services, and we were able to go and experience the majority of what was offered to service users within primary mental health services, which was good.
Mentors have helped me in my studies and on placement in a variety of different ways. I think in my last placement I had a mentor who really encouraged me and inspired me. I now have an idea of exactly where I want to go in life.
And I found as a first year I was always comparing myself to other people in my cohort. They seem to know more than me. And a very good mentor of mine actually instilled in me that don't do that. And that's the best bit of advice I think I've been given. She was like, these are your positives, and she always looked at what I was good at with me, and despite the situation we were in, she'd say, you're really good at this, focus on that, that will come with time.
And the other things I like about being a mentor is that you develop new friendships.
Definitely.
You sort of see you growing from first year to second year and becoming a midwife, and then trying to push you along to become even greater. That your standards are really high, and that you become a competent, proficient and enthusiastic midwife.
Yeah. And I do feel that from you and all of the team members, mentorship, you all value that, and you really do go above and beyond to make sure that your students achieve the best.
To be a good mentor, you need to know how to nurture students' progress and support their development, and also to challenge students as well. And one of the issues for students in practice is to understand the workings out of practice, as it were. So it's not enough simply for students to be with the mentor. What really matters is for mentors to be able to talk about what they're doing whilst they're doing it. Ultimately, they're accountable for delegation and accountability for those assessments, because those assessments constitute 50% of the nursing programme, and that contributes to the gatekeeping of the nursing profession.
I had a first year student on the community once, and we entered somebody's home that we'd never met before. We were visiting them postnatally, and just sort of thinking about cultural respect, etc. And the family offered us lots of lovely food and drink, and my first year student was a little bit concerned about that it would make her nauseous. She had a bit of a weak stomach, but she did really well, and I remember sort of just giving her a little reassuring tap that it's okay, and the family were very embracing and sort of could understand how she felt, but I thought she handled it really well, that she wasn't rude or inconsiderate of their values, and they wanted to offer her some nice things, and I thought that was a really interesting moment where it could have gone horribly wrong if she spat things out or been quite rude, but she really took on board the importance of that cultural role.
I'm in a position that I've had student nurses who have actually qualified and have gone through their preceptorship. They've become associate mentors, and now they're in the position to mentor the students that are coming through. But it's so important that we get mentorship right, because we are nurturing the nurses of the future, and we need to ensure that standards and values are adhered into and enforced into our practice.
If the students you've got with you aren't able to get the competencies, it's a hard job sometimes to be able to approach these topics and discuss with the students where they might have other difficulties, but it is really important to be able to do that with the support of other mentors you've got, or from the practice education team, and also from the university, to make sure that the students aren't completing their placements without being able to actually be fully competent to do the skills required.
Students have got to be able to come to you with their questions. You've got to have a good relationship with people to be able to sort of guide them through that, as well as assessing at the same time. You've got to be able to sort of critically assess, but whilst you keep a good relationship so they don't feel like they can't come to you with problems and their questions. It's achieving a good balance there.
Not being afraid to approach difficult things, and if something isn't right, to be able to say, right, this isn't working, we need to look at how we could make it better.
You need to be a certain character to become a nurse. It is a very privileged job. We deal with very sensitive situations with our patients. As a staff nurse then, we like staff nurses to be very capable and competent within all their nursing development, and to have a thirst to keep on developing within our career. And I just hope that when we have our students with us, they can see how much we do enjoy our jobs and thrive within our settings.
Somebody that you look up to, somebody that has that ability to inspire the new nurses coming through, somebody who loves nursing, somebody who loves patients and who wants to do the best for their patients and their relatives.
We've seen a lot of stuff together, good experience with some lovely home births.
We've been up the valley, and wellies and mud, and almost falling in the mud. And,
the wheelbarrows,
getting the wheelbarrows. Yes, really, sort of like, because you sort of taking your equipment over to a teepee isn't, sort of like carrying it isn't ideal for your back. So what we do is we get the people that live there to leave us wheelbarrows where we can park the car. Yeah. So we put our kits all in the wheelbarrows, and then we have a wheelbarrow each to go over the fields and the paths. And that in the middle of the night can be daunting. It can be sort of like when you've got your wellies on and your coat and everything, and sort of like, are you right, Jade?
When I am mentoring students, the passion for nursing that I've had since I was young, it comes out. I hope it comes out. I mean, they have said to me in the past, that you can see that you were really enthusiastic and you're really passionate about your job, and I am. And that again is one of the important things about being a mentor.
No, I think as qualified nurses, we all have a part to play in mentoring the nurses of the future. And I think really it shouldn't be a choice of being a mentor. It should be mandatory that we all take part in training the nurses of the future.
The buzzword with nursing is always empathy, isn't it? We all talk about people having an empathetic contact with a nurse, but really I think, it's all summed up in the word link to me, because a nurse provides the link between so many people. The patient, obviously. I suppose for nurses with lots of people passing through, you're going to need to be able to compartmentalise, your life in the ward or in community when you're visiting people, to protect yourself. It's something for our own sanity in a way, that we need to be able to come into work and say, right, this is our job, and I'm dealing with you now, I'm talking with you. And that's something that we need to do. And if you're my nurse or I was your nurse or whatever, we would be dealing, and there'd be a certain professional boundary that would be needed, a respect that needed to be observed. And outside of that, that bubble or that circle, it's gone. But you come back into that circle each time we meet. And that's an important thing to remember.
Being an advocate for me learning. So my mentors would always be a bit cheeky and ask if I could go maybe see a cesarean, maybe see different things in the hospital that, and not just, you know, staying with her sometimes. So I've been an advocate, so putting me in every single situation to facilitate my learning as best they can. There's a lot more to it than just the experienced and trusted advisor.